In today's episode, we will explore the topic of sharing individual performance data with learners, including recent trends, benefits, and challenges with this practice. We will also provide recommendations to programs considering changing what is shared with individual learners. Let's talk about holistic success. Hi, everyone. I'm Kelly Dore. I'm the co-founder and VP of Science and Innovation at Acuity Insights. Welcome to this episode of the Holistic Success Show. Our guest today is Sylvia Mioduszewska, who leads product management on our 145 program management solution. I'm excited Sylvia is joining us today because she works closely with so many of our partners to develop 145 further, and she knows the ins and outs of program management across health sciences. She's here to talk about sharing performance data with learners and their benefits and challenges. Welcome, Sylvia.
Thank you, Kelly. I'm excited to be here.
I'm really excited to have you here, but also to talk about this topic because it can be a little polarizing for some folks. Some schools are really about sharing information and being very broad, and other schools, maybe want to hold things a little bit tighter for different reasons. And so it's important that we talk about it. So let's get started.
All right.
So question number one, let's start off with, you've talked to so many programs. You've heard a lot of different perspectives. What do health science programs usually share with their learners to help them understand how they're progressing in their program?
I would say it's really varied across schools. There's some consistency, but I would say overall it's very unique to every institution. And there's so many assessment methods in every health science program, let alone within a given school. So there's graded examinations, usually in quizzes, and formative assessments, and summative assessments, of course, and there could be peer evaluations and self-assessments and self-reflections and portfolio reviews and labs and evaluations and all of these like research projects that come into it as well. And then if you're actually on the clinical side, you're going to see clinical evaluations, feedback from simulated or standardized patients, and it goes on and on and on, all the different things that learners are assessed on and by over the course of their education.
It sounds actually overwhelming when you think about the total amount of data that's collected on learners throughout their entire course of a program. Is it as overwhelming for programs, do you think, as well, in terms of managing and understanding or like having all that data?
Oh, absolutely. It's one of the reasons why we developed our analytics product. I think when I was at a medical school, we did some of the early interviews with what was called the cross-platform reporting tool in 2017. And we sat at the table and realized how many data sources we had and how many were in different places. And I think from what we hear in medical school specifically, they have 30 different data sources they're looking at to understand how their learners, their faculty, and their programs are performing.
And I know of some, without naming any names, who still use paper in terms of collecting information because that's what works for them. And we know that the difficulty with paper is that it's also harder to integrate back into the system. It gets maybe put into an Excel spreadsheet somewhere. And then the difficulty is not everybody has access to that Excel spreadsheet.
Absolutely.
So it sounds like it's a combination of lots of data in different places, and also access to that data as a whole.
The same goes for learners too, right? They're the ones actually who the data is on. So I think some of the sharing issues could potentially be part of how many systems we have to give them access to, or how do we pull that data in and integrate it in a way that's usable. So I think there's a lot of challenges in just the depth and breadth and different places that data lives and how it's stored.
Absolutely. But I'm sure there's a lot of learners who want this information. It's hard to hold together in your head where you're at across everything. There's probably definitely some key metrics that stand out for them, but maybe they don't have knowledge of all of it and how that impacts their growth.
Absolutely.
What are some of the trends that you've noticed in sharing individual learner performance data directly with learners? What are some of the things that you're seeing when programs are sharing it or are starting to think about it? What are you seeing?
Well, as I mentioned, there's so much variability in terms of what is shared and by whom. And I think I've noticed a trend that I think it aligns with what we're seeing in major board exams, like the USMLE Step 1 going pass fail. And I think there's this idea of trying to take the stress and burden off learners, from watching their assessments and scores and worrying and focusing more on confidence and mastery of skills and knowledge and promoting a growth mindset. So I think there's been a kind of pulling back of sharing some of those assessments. or maybe at least that maybe some new assessments aren't being shared. So it could just be a balance as the toolkit grows, that maybe some things are no longer shared and new things might be shared differently. But I think what we're seeing is a trend towards not sharing individual results with learners, or at least not sharing as much.
Yeah, and it sounds like there's this tension that exists potentially with either learners maybe maybe wanting to know everything or wanting to have transparency with the learners where they're at, but understanding that, it could be overwhelming, or there could potentially be an over focus on certain outcomes, certain data points that could inhibit the ability to have, what you described as this growth mindset,
Absolutely.
really thinking about, what's next, where do I need to grow, what do I need to focus on, that you could be almost be have paralysis from too much information
Absolutely.
at once. So knowing that there's this sort of tension, what are the benefits to actually sharing data directly with learners?
I think there are so many benefits to sharing this data, and you have to really consider which ones outweigh some of the other things that are, not a benefit. But I think direct feedback really allows learners to get a really clear understanding of their strengths and their weaknesses. And that self-awareness is crucial in health professions where continuous learning and self-improvement are essential to their lifelong, career. And this sharing promotes a reflective practice, which leads to deeper understanding, better integration of these knowledge and skills that are so important. Um, I think that feedback can boost motivation, especially when there's positive reinforcement. And then even constructive feedback when well delivered. And there's going to be a whole other discussion on how to give feedback that we can get some
That's
mutual.
another show, Sylvia. We
Yeah,
have
and
to
we
spend
know
a
we can
long
bring
time
into
talking
that,
about that.
right? But I think the idea of constructive criticism can really motivate learners to improve, and it also builds trust between the learners, their faculty, and their programs. And I think when learners are aware and have access to some of their performance data, if not all of it, can have a heightened sense of responsibility and accountability to address areas of concern.
Interesting. I think using the information to motivate, is a great concept of how, and a principle maybe of how to apply it and think about that data, that we have, because being intentional about the sharing of information, and having a goal in mind with sharing probably could help programs almost frame what data is important for them to share, or what they need to provide in addition to just sharing a data point. Maybe there's other information that they need to provide that.
Absolutely.
Now, what about the contrary? How might the sharing of this data actually hinder the learners a little bit? Thinking about the other side of it, because obviously we talked a little bit about the pulling back of information, but maybe we can unpack a little bit more. People are concerned about sharing all this individual data.
Sure thing. I think what we're hearing is really what we touched upon earlier in this idea of, there's the increased stress and anxiety that we're seeing in learners, especially as they're going through their training. I've seen this particularly in Canadian residency programs that are in an EPA-based curriculum, where the residents feel like they're constantly being watched and assessed, and they're really struggling to get the required number of observations to be considered for progression through their stages of training. So there's idea that it's really kind of heightens that stress and anxiety. You touched upon feedback overload, and I think there's a really key piece about when you have too much feedback from too many different places, it can make it hard to prioritize and act on what's really important. I think you can also overemphasize numbers. And so things like test scores, might pull learners to focus on those areas instead of broader learning objectives or other things that are more important. So that weighting of that information, I think, is really important. A big one that we hear about, though, is comparison with peers. And so comparison is, as we know, a huge issue for all of us, every human, but especially I think in medical education and health sciences, that can really hinder collaboration and teamwork if you're more focused on getting a better grade than the person next to you. Finally, I think there's a fear of receiving negative feedback. And that makes some students risk averse, and they avoid challenges or learning opportunities that could be valuable to them. And there's so many other reasons, but I think those are the really ones I think about in terms of the big ones. And yeah.
Yeah, absolutely. And you can see some of those things playing out, whether it's the overemphasis on numbers or the comparison to peers. When you think about, how maybe curriculums are moving to pass fail, or even, licensing exams. We've seen in the U.S. For medicine, the USMLE step ones moved to pass fail, and how that changed the emphasis on how you're going to perform. But you also see the pattern that then people are prioritizing performance on the step 2 examination. So, there's this drive that even though we're trying to curb it with, moving things to pass fail, that there's sort of a focus on, okay, so what number can I focus on? What data can I use? How do I study to this test? Again, so it's interesting that you're right. We be exemplifying or expanding that across the students.
Students also we're still human, right? So we all want to know how we're doing, and I think we naturally tend to compare performance. I think it's not an unnatural drive. It's just the results of that drive. I think that can be really stressful and anxiety inducing, especially if you're one of the students maybe is performing not as well as they want to be. So I think there's a balance. I think you have to know that information and figure out what works individually.
Absolutely. So with all of this under consideration, there's no clear answer here. What are the recommendations to programs considering, how to share data or even what performance data they should share with their learners?
I think you're right. There's really just a wide variety of things that schools should and could consider. And I think every individual school has to make that choice and evolve that decision as their student body evolves, because I think that's part and parcel of that. It's what we learn about learners, and it's also what they tell us. I think having that communication is really key. And if they're telling you that they're struggling because they're not getting enough data, then you have to consider that. If they're struggling because it's too much, it's also considerations. Like communication is really important. But I think in addition to that, I think the regular review of your assessment methods and your strategies is vital, and that'll ensure that they align with your educational program objectives and your learners' needs. And I think there's an ability to kind of think about maybe changing and shifting away from traditional grading systems and thinking about emphasizing competence and mastery, and thinking about competence and mastery, specific skills and knowledge, which can promote deep learning and understanding, and allow learners to progress at their own pace, because they're all not going to progress through those levels at the same time, and allows them to carve out their own trajectory. I think some things are probably fairly obvious. I'll mention them anyway. I think if you're going to withhold results, it should really be clearly communicated at the front line. So make sure that you are setting expectations and reducing that anxiety. And you should couple that with really transparent grading and having a clear and fair grades appeal process. And that should be clear. Whether or not you're sharing or not sharing results is all important. So let's just be clear on that. I think you have to find a balance between formative and summative assessments, and then because you still have to prepare learners for high stakes evaluations and exams, and they have to be able to understand their progress and where to focus their attention. If you're not sharing enough feedback and enough results, they may not be prepared for those exams. And that's one of the big things, outside of the bigger overarching goal of health professions education, is you want them to actually succeed in those exams. But I think the biggest thing I can really say is that the important thing is that feedback is given and shared, and less about the access to individual results. So I think this is especially true if you have a clinical experience, and the evaluation forms are really, and we'll call them assessment forms as well, but evaluation forms should be really more about capturing feedback in the moment that was given in the moment than it is about communicating how they performed at the end of their clinical experience. Like by the end of that rotation, whether a final evaluation or assessment is distributed or not to the learner, they should know what their strengths and weaknesses are and how they perform. But there shouldn't be a guess at the end of it, like, oh gosh, I really didn't do as well as I thought I did. That feedback should be ongoing, and it should be verbal, and it should be, where possible, in person, and face to face at least in some way. So I think that's the key piece.
I love that. I really do, because I think that's one of the key things is it shouldn't be a surprise how they do at the end of their rotation or at the end of a particular course or anything like that. They should know, because they should be getting feedback along the way. So how do we, because then they can course correct if they would like to. Sylvia, this has been such a fun conversation. Thank you so much for sharing your insights today. I can't wait to chat more about different topics like feedback that I know everybody's itching to think about. How do we think about this differently? To all of you who are watching, thank you so much for being here with us. Don't forget to subscribe or share this episode with a friend or colleague if you think it might be interesting. And with that, see you at the next episode. If you enjoyed this episode of our show, please be sure to check out the other episodes. And don't forget to subscribe. We have a new episode releasing every week.